Good morning, everyone. We're going to give just a minute for people to join and then we'll get started. All right, we're going to go ahead and get started. Good morning and welcome to today's Recovery Summit session. This webinar is part of the Recovery Summit series hosted each September by St. Clair County Community Mental Health in recognition of National Recovery Month. A few quick reminders. Today's session is being recorded and will be available on the SCC-CMH YouTube channel. Also, please use the chat box for any questions or comments. Our presenter will address them as time allows. For those requesting continuing education credits, please be sure to remain on the webinar for the full session and complete the survey that will be emailed out to you after. We're honored to be joined today by Senior Administrative Coordinator from Region 10, Cindy Eckert. Welcome, Cindy.
Thank you, Christy. Good morning, everyone. It's great to be here. I still see our numbers going up just a little bit, so hopefully everybody can hop on and join us this morning. Like Christy said, my name is Cindy Eckert, and I work at Region 10, and we're going to talk about substance use disorder services and trends this morning. I do have a colleague with me, Peyton, so if you see me or hear me, ask Peyton or refer to Peyton. So Peyton Frazier is here with me also this morning. So we can go to our next slide. As I said, my name is Cindy Eckert. I'm a Senior Administrative Coordinator here at Region 10 for SUD, which is Substance Use Disorder, and I'll use just SUD most of the time during today's presentation. I'm the coordinator for SUD treatment, recovery housing, and women's specialty services. I have been at Region 10 for about 7.5 years. And a fun fact, in a prior life, I was a competitive figure skater, so I still am involved in that world. So for those of you that do ice hockey or ice skating, welcome to the community, and I'm one of your fellow skaters. So about Region 10 PIHP. We are one of 10 PIHPs in Michigan. Region 10 covers the southeast corner of Michigan. Well, not the corner exactly, but over by the water there, by the Blue Water Bridge. We start in Port Huron. We cover Genesee, Lapeer, Sanilac, and St. Clair counties. And our office is physically located in Port Huron in St. Clair County. Our contract is with MDHHS, the Michigan Department of Health and Human Services, and it's primarily to manage specialty mental health and substance use disorder treatment for those that have Medicaid. We do get a few other contracts, smaller contracts that cover specialty, usually substance use disorder, specialty little niches for substance use disorder. You might have heard of the SOAR contract. We have that right now. We also have an alcohol use disorder and another healing and recovery funds, which is partly funded by opioid settlement funds. So some more information about Region 10. In our region, we have 4 community mental health service providers, or CMHSPs. There's typically one of those in each county, and that holds true for Region 10 as well. So the 4 are Genesee Health System in Genesee County, Lapeer County Community Mental Health, which, as you guessed, is in Lapeer, Sanilac County Community Mental Health, and St. Clair County Community Mental Health. Those are the 4 CMHPs in our region. We have 22 contracted SUD providers in Region 10. Some of those providers have services that range from early intervention to residential and recovery housing. Some of those contracted providers provide only one service for us, or they facilitate one event or facilitate one type of service for us. Our 4 counties in Region 10 are very different from each other. So Genesee County is our most populous, has a large urban area, the Flint area, serves the largest number of individuals for Region 10, has significant cultural diversity, offers the most resources for their residents, and all levels of SUD services are in Genesee County. You can find everything from prevention to recovery housing right in Genesee County. That is the only county, I believe, in our region that has all levels of SUD care, all levels of SUD services. St. Clair County is the next most populated. Their largest city would be Port Huron, which is where we are right now. That's a smaller urban area than Flint, although there is some cultural diversity here and many SUD resources other than residential are found in St. Clair County. There is no residential SUD provider in St. Clair County. Lapeer County is our 3rd most populated county. Fewer SUD resources, less cultural diversity. SUD prevention and outpatient services are offered there. Currently, there is no residential or recovery housing offered in Lapeer County, although I know there's been talk by one of our providers to do that, but that hasn't happened yet, I don't believe. Sanilac County is the least populated. It's our most rural county. We have the fewest number of individuals serviced there. Fewer resources are offered. There are prevention and outpatient SUD services. Right now, Region 10 does not fund any recovery housing or residential services in Sanilac County. Some of you might be familiar, and I guess our most public-facing part of Region 10 is our Access Department. We used to have 2 Access Departments, one here in St. Clair County and one in Genesee County at GHS. Currently, we've condensed that. It's all located here in Port Huron, and we have 1 Access Department. So if one of our beneficiaries needs to or requests an authorization for services, this is the department that you call. These are the people that you talk to. So we have information here on this slide that talks about fiscal year 24, and it gives a breakdown of the number of calls that we get in Access and where those calls go or what happens when they call. So for the whole fiscal year of FY24, which goes from October 1 of 2023 to September 30th of 2024, there were 24,592 calls into our Access Center. That's a lot of phone calls. So that the phone and Access rings obviously all the time. And if it's a weekend and someone needs crisis services or anything like that, we have an answering service that helps and picks that up. And we also have clinicians who are on call on the weekends and at night. So don't think it's only calls that happen during the day, typical business hours. Calls come in all the time, 24/7. For SUD services, the very bottom line of this chart talks about SUD outpatient. So that number at the bottom is the number of calls Access received and the caller asked to go to SUD outpatient services. So for example, in October of 2023, there were 375 calls for SUD outpatient services. If you go up to a year ago, September of 2024, 322 calls were received for SUD outpatient services. The number's pretty steady. I see the lowest is 281, but usually 300, the highest being like The 375, I think, is the highest on that list, but it's right around 300, I'd say, every month. If someone calls and they're asking you to go to a higher level of care for SUD services, they likely need to have a screening. And so that's the first line that you see in the disposition box where it says access screening on the left. Those calls actually speak to a clinician in access, and the number of those then get referred for a higher level of care, higher than outpatient services. Typically, someone needing residential might also need some withdrawal management or detoxification services. So they would talk to the clinician and determine the best care that's available for them at that time. And you can see that number is significantly higher than those calling for outpatient services. So well over 1,000 every month of those calls come through. Other calls of the 2,000 to 3,000 received every month are for mental health services or other types of services that we have through our CMHSPs that are offered to our beneficiaries as well. Most of these are phone calls. You'll see there is a face-to-face line under the types of calls. Very few individuals have an actual face-to-face contact or screening with the clinician. The majority of our authorizations and referrals for services come through a phone call. That's it for that one. Our substance use disorder provider network covers all of our 4 counties. So across the region, we have to make sure that Region 10 has available to our beneficiaries every type of and every level of SUD service. And that starts at prevention, early intervention, and then goes all the way to residential and recovery housing. To cover all of those services in those 4 counties, we have 22 contracted SUD providers. Some providers have services in multiple counties. Some of our providers, as I mentioned earlier, only provide one type of service, or they do one event or one type of, I guess I would say, a service for us at a time. Our contracts are issued for a year, and we operate on a fiscal year, which starts October 1. In a couple of weeks, we'll have new contracts. A new fiscal year starts October 1 of every year and goes to September 30th. We operate on the state fiscal year, so we follow that. In fiscal year 2024, which would have ended a year ago, but it's the most current year that we have all of the data for fiscal year 2024. We have some admission demographics here. So our total admissions for substance use disorder services in FY24 were 7,189. Now, that doesn't mean 7,189 individuals. That's how many admissions. Some individuals have more than one admission in a fiscal year with Region 10. So one person might be admitted in the beginning of a fiscal year. They might go through a treatment episode, get discharged, go out and have some challenges or some struggles, and then call access and return to services again later in the same fiscal year. That's not unusual. So 7,189 is the number of admissions that we have into programming. Of those 7,000, 4,432 or 62% identified as male, 38% or about 2,757 identified as female. 65% of those individuals have never been married. 4,624 of those, or 64%, are currently unemployed. And then the age breakdown is a little bit interesting, I think. ages 26 to 39 is our highest number of individuals are in that age range for our region. So 3,204, 45% of those admissions are individuals who are 26 to 39 years of age. The next highest group is ages 40 to 49. And then the next after that is ages 50 to 64. And the age 50 to 64 bracket has gone up in the last couple of years. I think in general, the ages of those being admitted into SUD treatment has trended a little bit higher. For race in our region, 75% identified as white, and 22% of those admissions were identified for Black or African American individuals. So this graph talks about our admissions by service type. In our region, by far, the largest number of services are for outpatient services for SUD. Kind of interesting in that the number of access calls for outpatient was lower than residential, but as far as admissions to services, we have far more admissions for outpatient services than anything else in our region. So just over half of the admissions for SUD are for outpatient. 20% are for residential short-term, which would be residential services less than 30 days. So 30 days or fewer for residential. At the same time, most people get withdrawal management referral. They also get a residential short-term referral. So it doesn't surprise me that those two numbers are very, very close. So they both come in at 20%. There are a few numbers different. 1,421 were admitted for withdrawal management in FY24. Like I said, if you receive a withdrawal management or a detoxification referral, you will also get a residential short-term referral at the same time. Those come together from Access, and you do have to call and speak to a clinician and do a screening to get that referral. SUD-HH. SUD is substance use disorder. HH stands for health home. This is a relatively new program. It's now part of Medicaid for the last, I think, 3 years. We've had SUD-HH admissions. 587, or only 8% of our admissions were for health home admissions. So this number continues to go up. This is the first year in FY24 that we've recorded this as a separate admission type. An SUD health home is not a physical location. It's more of a case management and a care management system. Individuals that participate in the health home receive case management, recovery coaching. They have medical team that reviews their case and makes sure that they are connected with the resources in their community that will best support their recovery. So health home individuals have a myriad of services that they're involved with, not just treatment, but they get recovery coaching. They might be in recovery housing. They might receive some nutrition information related to whatever medical issues. They're probably going to be connected to a medical clinic, PCP. They also may receive employment or educational referrals and resources. So an SUD health home participant has a lot available to them. Only 1% of our admissions are for intensive outpatient. Intensive outpatient services are those for individuals who don't want to be in residential. Maybe they're working, can't afford to be in a residential setting, but they want services more than just the typical outpatient, which would be about an hour or 2 hours a week. Intensive outpatient programming generally runs from 3 to 9 hours a week and can involve group as well as individual sessions. And our lowest number of admissions is for residential long-term services. Residential long-term services would be at least 30 days or longer in a residential setting. We really have only one or two programs that would even offer that type of care or facility that can support that type of programming. So it's very unusual. And like you see, it's less than 1%. Only 7 individuals in all of FY24 were involved in residential long-term. I would suspect many of them also have some additional needs and challenges that would require their stay in residential to be extended over the 30 days. This slide talks about the primary substance of abuse. So for those individuals that came into services in FY24, these are the top 5 substance of abuse that was reported as the primary reason that they were seeking services. So alcohol comes in at the highest at 34%. So 2,427 individuals stated that they were seeking SUD care because of their use of alcohol. The next highest in FY24 was cocaine or crack at 16%. 15% reported heroin was the primary substance that they were seeking services for. 11% reported methamphetamine or speed was the reason they were seeking services. And other opiates also came in at 11%. That's the top 5. I suspect in FY24, number 6 happened to be marijuana. But that is not always the case. And we have a later slide that talks about the changes in the primary substance of abuse in the last 5 years, because that is a trend that has been happening. So this talks about Region 10 SUD services by county. So you can see from the numbers on this slide, by far, the majority of admissions for SUD services in Region 10 are in Genesee County. They have 72% of the total admissions in FY24. And that's no different than pretty much any other year. They have the largest population and they have the largest number of admissions. Lapeer had 6% of our total admissions. Sanilac County had only 2%. St. Clair County comes in behind Genesee County with 20%. But still, there's quite a difference, a significant difference for sure, between 20% in St. Clair County and 72% in Genesee County. So you'll understand kind of the number of admissions and the number of those seeking SUD services closely correlates with where the resources are. As we talked about earlier in the slides, Genesee County has the most SUD resources. They have every level of care. And of course, given that they have the larger number of admissions, that makes sense. Typically, for each county, the majority or the largest number in the age groups, excuse me, was the age group of 36 to 39. Let me get some water. So for that age group in each county, that was the largest age group admitted in FY24. Over half of those in Lapeer County who came in for services were in that age group, just about half for St. Clair and Sanilac County. Genesee was just under half at 43%. So they probably have a wider range of ages in Genesee County, but clearly Lapeer, Sanilac, and St. Clair County, I would say about half of their admissions were in that age range. Unemployed for all the counties was the largest of employment sectors. Genesee County reported 70% were unemployed at the time of admission. Lapeer, Sanilac, and St. Clair all came in right around 50% again. So 52 for Lapeer, 56 for Sanilac, and 50% for St. Clair County of the individuals admitted for SUD were unemployed at the time of their admission. You'll notice in Genesee County, just over half were admitted for outpatient services, and the same for Lapeer, 52%, 54%. But that has a drastic change when you go to St. Clair and Sanilac counties. In Sanilac County, only 33% of their admissions were for outpatient services. Interesting in that the only service we really offer in Sanilac for SUD is outpatient. So obviously, those individuals in Sanilac County are leaving Sanilac County to go to their services. They're traveling to a different county if they're going to go for residential substance use disorder services. And then in St. Clair County, about 45% were admitted for outpatient services in 2024. Withdrawal management, WM stands for withdrawal management. Some of you might be familiar with the term detox, and that is it's the same as withdrawal management. In Genesee County, 18% of the admissions were for withdrawal management. In Lapeer, that goes up to 22%. In Sanilac County, it goes as high as 39%. And in St. Clair County, 25% of their admissions were for withdrawal management services. I think it's a significant difference between Genesee County and Sanilac County. Again, the only services we offer in Sanilac County that are Region 10 funded are outpatient. So those individuals in Sanilac County are traveling to a different location, a different county, to get their substance use disorder services. And then the last type of care, residential. 19% of the Genesee County admissions were for residential, 18% in Lapeer, 26% in Sanilac County, and 25% in St. Clair County. This is the slide that I mentioned earlier. This talks about the primary substance of abuse. So this is when a person calls Access and they say, I need substance use disorder services, and then they're asked for what reason. This is the primary substance that they report that you are seeking services for. And you'll notice from fiscal year 20 through to fiscal year 24, every year alcohol has the most. That has been true since the beginning of Region 10. It has not changed. It remains pretty steady in the 34 to 36. I see in FY23, it was as high as 38% of those individuals calling. It didn't seem to change much even during COVID. It stayed at about 35 or 36%. And then in fiscal year 23 went up to 38%, and in 24 is at 34%. I don't anticipate it will be any significantly different for FY25. We haven't noticed that happening. So for fiscal years 20 to fiscal year 23, heroin was the second reported top primary substance of abuse. It has, though, if you'll notice, from FY20, it was at 29%. And then in FY23 went to 17%. And in FY24 was bumped out of its second place position, if you will, by crack cocaine. And it fell to 15%. In FY23 and FY24, the heroin and the crack cocaine kind of just traded places and remained pretty close to each other as far as percentages. In FY23, heroin and crack were tied for the number of individuals, the percent of individuals rather, reporting that that was the reason they were seeking services. Another trend you might notice in FY20, we had crack cocaine and then other opiates. And in FY21, the yellow line, you'll see that those two traded places. other opiates and crack cocaine kind of switched, but they didn't really change in percentage. So I don't know that the difference is that significant, but when we report numbers, other opiates had a couple more individuals than the crack cocaine, which is why they're in that order for FY21. The same thing in FY22, the green line, crack cocaine and other opiates flipped back again. So crack cocaine and other opiates just seem to be trading back and forth there for those 3 fiscal years. In FY23, however, the other opiates was replaced with methamphetamine or speed. So that's a pretty significant change. And that remained true for FY24 as well. The methamphetamine and the speed category maintains its 11% of those individuals seeking care, but it has taken out the other opiate category in the last 2 fiscal years. Not sure what FY25 has in store for us yet. I haven't even run any preliminary numbers on that. I have no doubt alcohol will still maintain the primary spot. As far as the other 3, I can't make any predictions at this point about what might happen in FY25. It will be interesting to see. One of the other services that we have here in SUD at Region 10 is the Women's Specialty Services Program. Some of you may not have heard of that. Some of you might have heard of WSS, which is what Women's Specialty Services stands for. We have a separate category of funding to address concerns that are specific to women who are seeking SUD treatment and recovery services. The funds are geared toward pregnant women, women with minor children, and men who have primary custody of minor children. So we actually have males or men who are in services that will be admitted into our women's specialty services designated category. And I know that sounds kind of funny, but it does happen more and more so. The provider or our contractors that provide these services are designated as a WSS program by the Michigan Department of Health and Human Services. They have to fill out a survey. They have to answer some questions. They have a site visit. And at that time, then they can become a designated WSS program. When I started here at Region 10, I think we had 3 or 4, probably 4. We have 3 right now in FY25. Next year, we're only going to have 2. We have one who's withdrawing or not going to provide that service anymore. So another trend that I've noticed at Region 10 is the decline in the number of admissions into our women's specialty service program. I don't think we've also had a decline in the number of women's admissions by number, but because our age of admission is increasing slightly, it's possible that the women who are coming into treatment either no longer have custody of minor children or they're not pregnant at the time of their admission. So I suspect that's the reason partly for some of the decrease in the numbers. But I thought this was another interesting trend that I don't have a total explanation for yet, but in fiscal year 24, 443 individuals were admitted into the Women's Specialty Services programming, not pretty similar to FY23. You'll notice though in FY20, the percent was 9.2% of our total admissions, or 824. So that's a pretty significant decrease from 824 to 443 admissions. So it's just interesting to note. And I'm starting to track that a little more earnestly to try and figure out if there's a particular programming reason or if the number or the location of our programs is significant to that. So just something to take note of. The next slide will give us some information about the programming and the services for the women's specialty services. So the idea is to provide support for women's recovery, and we also use some of our women's specialty services in Region 10 to have an annual Women's Recovery Conference. It has happened in August, primarily for the last 3 years. This year it was the very last day of July, July 31st. It's an all-day event open to anyone. You don't have to be a women's specialty services provider, but it's open to any provider in our region. And it's also open to those individuals who have lived experience or are currently in treatment. So if there's a woman and her infant, we gladly welcome them to the Women's Recovery Conference for the day and try and provide them with information and resources and networking to help them with their recovery journey. Last year in FY24, we also had a media campaign that promoted the women's specialty services in our region. Specifically, we had a mailing that went out to OBGYNs. We had postcards and flyers and different types of media campaigns. We did some social media. We did some TV spots and some other media advertising and things, billboards, to promote women's specialty services and treatment in particular for women in our region. And partly that was in response to the declining numbers that we saw from fiscal year 20 to 24. There are criteria for a program to be designated as a WSS program. There are several federal standards and criteria that have to be met for the programming, and those are listed there. The program must be able to provide primary medical care for mom and children, and that would include prenatal care if it's needed, or immunizations for the children if those are needed. They have to have the capacity for gender competent SUD treatment services for both mom as well as children or any minors that are involved in care. One of our women's specialty, well, actually two of our women's specialty providers allow women to bring their children with them into the residential setting, which is pretty incredible. So there's a lot involved there, as you might guess. Having children in a residential setting and having to either accommodate their education needs or their childcare needs is a pretty complicated and involves a lot of staff and coordination. And while the parents are receiving services, childcare should be available for the children. So if that's done at the location, or it could be the childcare is at a different location while the parents are involved in treatment services. Maybe the childcare is, across the street or down the block. Case management services and transportation are also provided for those individuals involved in women's specialty services. And as I mentioned before, currently in this year, we have 3 women's specialty providers, and I know in FY26 we will have 2. Flint Odyssey House and Sacred Heart will be our 2 women's specialty service providers in Region 10.
Got a question, Cindy. Do you want to wait till the end?
What's the question about?
Age groups.
Oh, sure, we can go back.
So the question is, you indicated some age groups on slides. However, I did not see ages 18 to 26. Could you address this?
That wasn't included just because it was one of the lower percentages of admissions, the 18 to 26, the younger. Typically, we don't have a whole lot of individuals in that age group seeking services through Region 10. Could be a lot of different reasons for that. So could be they're still covered under their parents' insurance and they wouldn't need to reach out to Region 10 for that. A lot of that age group up until the age of 24 now are covered under their parents' insurance, so they wouldn't be captured in our admissions. And a lot of times individuals in that age group aren't ready yet or aren't thinking they need to seek out services. So it's not one of our higher or it's not one of our most used age groups, I guess I'd say. We don't have a lot of admissions from that age group. Good question, though.
Mhm.
Next, we're going to talk about some customer satisfaction information. So there's a lot going on here on this slide. So every year, Region 10 does customer satisfaction surveys. We ask consumers who have participated in programming that we support what they think about the program. Was it helpful? Were people responsive to their needs? Did they get what they wanted? Did they get the type of services that they felt were beneficial for them? So overall, we ask everybody, whether they're involved in community mental health, whether they're involved in outpatient, whether they're involved in residential or autism or any type of services here from Region 10. So these numbers on this slide are for those who participated in the substance use disorder services, adults only. We do have some minors who participate in SUD services in Region 10, but the number is very, very small. And so the majority by far of our individuals who are admitted for services are adults age 18 and over. So we had 548 responses to our customer satisfaction survey in fiscal year 2024. These are pretty small, so it's going to be hard for some people to read. You might have to make it bigger on your screen. I don't know. The green shaded are positive or had the highest scores where people agreed or felt that this was more true than not. So they included things like staff believe that I can grow, change, and recover. Staff respected my wishes about who is and who is not given information about my treatment. And staff encouraged me to take responsibility for how I live my life. So those prompts on the survey received positive scores. I don't even know if I can read the ones in red that are, it's too small for me. But they include things like I was able to see a psychiatrist when I wanted to. My housing situation improved and I feel I belong in my community. Those were the prompts that overall received the lowest scores on the survey. You can see we had of the 548, 382 identified as white or Caucasian, 87 of those individuals identified as Black African American, and 10 of those individuals in Region 10 identified as American Indian or Alaskan Native. Interesting to know that the positive prompts are all similar. I mean, there are a few little differences between each group. The negative or the lowest average scores, I wouldn't say negative, but they were lower scores. And the common thread there was the ability to see a psychiatrist when they wanted. That tends to be program specific, site specific. If the SUD program you're involved in has a psychiatrist or has the ability to refer to a psychiatrist, that's easier accomplished, but there also might be a wait time for that. Receiving psychiatric services through an SUD program, there's always been a wait, unfortunately. That hasn't changed, and we're still working at trying to make that wait time shorter, but I know in FY24, that's likely going to be another comment that, or in FY25, sorry, it's likely going to be a comment that we see again. Strategic plan. So Region 10 has an SUD strategic plan. Region 10 has a strategic plan for the whole region for all of the services that we offer, but we specifically have a strategic plan for SUD services. We are required to do that, and it's submitted to MDHHS. And our plan was developed in 2023 for the fiscal years 24, 25, and 26. So we have one more fiscal year left in our current strategic plan. And at this point, it would be time for us to consider updating or revising or making changes or whatever we need to do to have a strategic plan going forward from FY27 on. We use data from a wide variety of resources to create our plan. We take things from the census data, we take state data, we take data that's divided by zip code. We certainly use county level data and develop what we think is a good approach for our region, whether it matches or doesn't the states, because our region has a couple of counties that tend to vary pretty significantly from state trends. Our populations of focus for our strategic plan included those living in a rural area, thinking of probably Sanilac County when we did that. Women living with SUD who have dependent children, older adults, and returning citizens that are under the supervision of the Michigan Department of Corrections. We also consider gaps in our services, which would include access to care, school-based prevention, and recovery housing in our strategic plan. One of our goals in our strategic plan right now is to increase availability of recovery housing. That's just an example of one of the goals that we have in our SUD strategic plan at this point. We've done better at that, I would think, since we developed the plan. I know we have more recovery housing availability. Funding for recovery housing is still a concern. Medicaid doesn't pay for recovery housing, although they will cover recovery coaching and some of the ancillary services with that. But we still have to find different funding to cover the actual housing for recovery housing. And that's something that Region 10 believes is a pretty important part of many people's recovery journey as having the recovery housing. So the SUD strategic plan is available on the Region 10 website. If you go to region10pihp.org, that's our website. You can find our strategic plan for SUD there. You can also find the client satisfaction survey information there, or the consumer satisfaction survey information there for FY24. I know FY25 is coming pretty quickly here, so that'll be posted shortly. And there's also a provider directory on our website. So if you go to the Region 10 website, you can also find a list of all the providers that we contract with, and the services that they offer are listed there. So if you had a question about what type of services you could be referred to, or you could get that are funded by Region 10 and where they're at, their location, and how to contact them, that's all available on our website as well. And I think that pretty much wraps up the slides and the information that we had for you today. That's my email, eckert@region10pihp.org. Deidre Slingerland is the SUD director at this time, and that's her email if you had questions or wanted to contact her for any information. And at this point, I'll just see if there's any questions that we didn't already answer.
There is a question in the chat. It says you indicated some age groups on slides. However, I didn't see ages 18 through 26. Could you address this age group?
I think we already got that one, Christy.
Mhm.
Sorry about that.
That's okay. No worries.
Also, could you, are there any new services that Region 10 is looking into bringing into our region for the substance use issues that we face?
That's an excellent question. We are always open to looking at new services, whether it's through a new provider or a new evidence-based programming or something we're not familiar with, but maybe it's offered in a different part of the state. I love hearing about new services. We are limited to providing services that Medicaid will cover. So if it's a Medicaid covered thing, we can certainly consider that. And if you have ideas about that, please send them to my email address. That'd be great. I'm not aware at this point that for FY26 we have any contracts for any new or different services. I don't think any of our providers have proposed a different or a new evidence-based practice for us.
All right. I'm not seeing any other questions. I was just checking the Q&A also, but oh, let me see. There are a few questions from did you already look at the ones in the Q&A section?
Yes.
Okay.
One question was, could we receive a copy of these slides? But
I think that would
yeah,
that would come from you, wouldn't it, Christy?
Yeah, the slides will be included with the survey email. So those will be sent out shortly after this.
Perfect.
And then there was a question about whippets that was already addressed.
Oh, no. Are you seeing an increased whippet usage? I am in therapy sessions.
Interesting.
Yeah.
Yeah, I've heard that in the Detroit area, in the Detroit metro area, there was an increase in that. I haven't heard about that in Region 10, but I wouldn't be surprised if it's in the Detroit area. It kind of travels from there, I'm sure. That's interesting that you point that out.
And then Anne Marie had a question. How does someone access the SUD HH? Does Access refer them or does the provider who already knows them suggest this? Do you know what the agencies provide? What agencies provide this service?
Yeah, there are 5 of our contracted providers in Region 10 that are health home facilitate the health home program. Let me put it that way. And they're generally our larger providers in Region 10, like Flint Odyssey House, Sacred Heart, New Paths, Biomed, those types of locations. And if you're wanting to do health home, if you call Access and mention that to them, they will certainly connect you with an agency that has that available. And then the agency or the organization can enroll you in that type of service. So if there are any problems or struggles with that, certainly let me know. But oh, Miranda's giving us all the information.
Oh, thanks, Miranda.
Nice. So I appreciate that, Miranda. So any one of those are health home providers, but you don't have to be in treatment with them to get the health home services. So I know you can be admitted just into the health home services program. So if there's an issue or questions about that, if you send me an email, I can connect you with the individuals if there's any struggles or challenges to that process. We can certainly help out.
All right. I think we've covered all the questions that have come through chat and Q&A. I was just checking one more time to make sure. But we appreciate your time and information that you brought today, Cindy. It was very informative and helpful. We hope that everyone that joined today got something out of it. And sorry, I'm all off on track, but thank you for everyone who joined this session. We hope the information was valuable and helpful. Today's presentation is just one of many webinars being offered throughout September as part of our Recovery Summit. For details and registration for upcoming sessions, please visit our website at www.sccmh.org under the Events tab. Also, keep an eye out for the short survey. It will include the slides and it'll come in your email. Your input is vital in helping us continue to improve and shape future events. For those requesting McBath and peer certificates, they will be emailed out in mid-October. If you're requesting social work CEs, your certificate will be emailed to you after payment is received, if applicable. Thanks again for joining us today. Thank you again, Cindy. We look forward to seeing you all at our next session and hope you have a great day.
Thank you.
Thank you.